మీ పీరియడ్స్ ఇర్రెగ్యులర్గా ఉన్నాయా? వెయిట్ సడన్గా పెరిగిందా? ఫేస్ మీద పింపుల్స్ తగ్గడం లేదా? అయితే ఇది సింపుల్ స్ట్రెస్ కాదు. మీ బాడీ మీకొక సీక్రెట్ వార్నింగ్ ఇస్తుందేమో. సీరియస్లీ, today we're diving deep into the reality of PCOS. It's a condition that is literally affecting millions of young women globally, and yet it's still so incredibly misunderstood. Let's figure out what's really going on.
Irregular periods, sudden weight gain, stubborn pimples. What's really dangerous here is just how incredibly common these three issues are. Society has basically taught us to totally normalize them. We think, oh, I've just been eating poorly lately, or man, I've been pulling way too many all-nighters. But actually, when these three symptoms start showing up together, they aren't just random flukes anymore. They're part of this interconnected web. Your body is this amazingly smart machine, right? And when its internal chemistry gets thrown off balance, it starts flashing these warning lights on the dashboard. Ignoring them, or just blaming the whole shebang on a super busy lifestyle, that's a massive mistake. You're completely unaware of this silent storm that's brewing right beneath the surface.
Let's look at a story that I'm sure is going to feel highly relatable to a lot of you. 25 years Anjali kuda alane anukundi. Koncham stress wala periods laid out to Nayani. She just brushed it off, just like so many of us do, right? Kani monthska ganchai, and the situation didn't just magically resolve itself. Actually, it escalated. Unexplained weight pedigindi, even though she literally hadn't changed her diet at all. Plus these really aggressive pimples bachai just covering her jawline. She tried, managing it with those over-the-counter creams, spending extra time at the gym, nothing worked. Eventually, facial hair could have started. And that's the thing, this gradual creeping progression over months, that is exactly how this condition operates. It doesn't happen overnight. It slowly builds, totally masking itself as everyday annoyances until you hit a point where you just can no longer ignore it.
So Anjali finally decided enough was enough. Doctor దగ్గర టెస్ట్ చేయించుకుంటే ఒక షాకింగ్ డయాగ్నోసిస్ వచ్చింది, PCOS. I mean, just imagine that overwhelming mix of relief and confusion sitting right there in the doctor's office. Relief because, hey, she finally had a name for the absolute chaos happening in her body. She finally knew she wasn't just imagining things. But confusion because, well, what exactly is PCOS? For Anjali, and honestly for millions of women getting this exact same news every single year, this 4-letter acronym is terrifying. And it's terrifying precisely because it just sounds so clinical and, well, opaque.
Let's break it down. PCOS, Polycystic Ovary Syndrome. And that word right there, syndrome, that's absolutely critical. It's kebalan periods problem kalu, or just some isolated issue with the ovaries, despite what the name might suggest. It is a highly complex, comprehensive hormonal and metabolic condition. In plain English, it means that the delicate symphony of hormones that basically run a woman's body is playing completely out of tune. The reproductive system, the metabolic system, the endocrine system, they're all misfiring. And when the body's chemical messengers get this confused, the effects are widespread. They're systemic, and they are completely relentless if you leave them unmanaged.
Seriously, me hormones, weight, fertility, skin, hair, any affect you. Let's look at this full body spectrum, which really hits 5 intricately linked biological areas. First up, hormones. This is the foundational root where an excess of androgens, which are often called male hormones, completely disrupts your natural cycle. Second is weight. This hormonal imbalance is heavily driven by insulin resistance. That triggers the ovaries to produce even more of those androgens. It makes weight gain super rapid, and weight loss incredibly difficult. Third, fertility. Because the hormones are so unbalanced, the ovaries really struggle to release an egg regularly, and that leads to those missed periods. Fourth is skin. Remember those androgen spikes? They trigger excess oil production, which causes that deep, stubborn cystic acne. And finally, fifth, hair. And this is the cruel irony of PCOS, right? It can cause unwanted hair growth on the face and body while simultaneously causing hair thinning on your scalp. Every single piece feeds into the others. It's a total full-body experience.
కొన్నిక్కడ చాలామంది ఒక డేంజరస్ మిస్టేక్ చేస్తారు. You see, as humans, we are totally conditioned to react to acute pain, right? A broken arm, a severe migraine. If it hurts, we immediately go to a doctor. But with PCOS, symptoms ni ignore చేస్తారు. ఎందుకంటే పెయిన్ ఉండదు. I mean, gaining a few pounds doesn't physically hurt. A delayed period doesn't put you in physical agony. కానీ లోపల బాడీ సైలెంట్గా సిగ్నల్స్ ఇస్తూనే ఉంటుంది. Your metabolic and reproductive systems are in there, silently sounding the alarm. And ignoring these painless, quiet alarms, that's what allows the syndrome to take deep root and get so much worse over time.
So, that brings us to the absolute most urgent questions. Mari PCOS ki exact reason enti? Enduku kanta mundi girls ki wastundi, while it entirely skips others who seem to have the exact same lifestyle. And most importantly, PCOS completely cure otunda?
Well, while there is no single magical off switch or definitive cure just yet, modern medicine is constantly digging into the exact causes. We do know that genetics and insulin resistance play massive roles. Like if your mother or sister has it, your chances definitely go up. And since we can't just cure it with a single pill today, management and targeted lifestyle changes are basically our strongest, most effective weapons right now.
But here is the most important takeaway for you today. What if you are unknowingly pouring gasoline on the fire? Part 2లో నేను చెప్పబోయే ఒక కామన్ డైలీ హ్యాబిట్ లిటరలీ థౌజండ్స్ ఆఫ్ విమెన్లో PCOS సిమ్టమ్స్ని వర్సన్ చేస్తుంది. అండ్ ఇట్స్ సంథింగ్ సో అన్బిలీవబుల్లీ నార్మల్ యూ ప్రాబ్లీ డిడ్ ఇట్ దిస్ వెరీ మార్నింగ్. మీరు కూడా అదే చేస్తున్నారా? Are you secretly making your own symptoms worse without even realizing it? You'll have to join us in part 2 to find out. Until then, please listen to your body, don't ignore those silent signals, and keep questioning what you think you know.